Recently, there has been a motor vehicle accident. There has been a family that was involved. A grandmother, a mother who is also pregnant, a dad, toddler, two twin 16-year-olds. They were all involved, and tragically, each one has been injured in some way, in some form. Today, we're going to walk you through the process of how we will evaluate and help each of the victims.
And I had 6 patients came in a motor vehicle accident. We went through triage. We had the first patient at first, Mr. G. He is breathing 45 minutes. He's confused. We hearing left core sounds. His right lung, absent sounds there. So we need immediate attention to him.
All right, let's take a look at this.
Okay.
All right, Mr. G, let me take a look at you.
Oh, goodness.
How are you feeling? Are you in much pain?
Yes, ma'am.
All right. Well, let me see. I'm going to listen to your breath sounds. Goodness, you're breathing heavily.
Oh, where am I?
You're in great trouble. That's where you are.
Oh, no. Christy! Where are you?
Oh, dear. My.
Christy!
Nothing's going to be all right, but I'll try my best.
Okay.
All right, I've checked out Mr. G. He is in terrible shape. We're going to want to start chest x-ray, keep him in PO, oxygen 3 liters per nasal cannula, and there's going to be a possible chest tube insertion.
Okay.
All right?
Okay.
All right. Here's the order.
Thank you. I just got the orders from the doctor. We're going to do a stat x-ray. The patient is kept in PO. I'm going to need you to go ahead and do a 3 liters O2 nasal cannula and possibly set up for a chest tube insert. Okay, got it.
Nurse Myrie, the doctor ordered 3 liters of oxygen. Can you assist me in the room while I check on the chest tube?
Yes.
How you doing today? I'm going to assess your lung sounds and check your chest tube while Nurse Myrie gives you some oxygen, and you should be breathing better.
Hello, I'm Nurse Mari. Put some oxygen, okay? Help you breathe better.
Okay. Who are you?
I'm your nurse. I'm here to help you. All right, she's all set up for you.
Okay, thank you.
Oh, Christy.
Okay, we'll be back. The doctor will be in to see you.
Again, doctor orders. We went in and assessed Mr. G. We gave him 3 liters of oxygen per doctor orders request, and we assessed his after we assessed his chest tube, he was stable. Okay, doctor, in from a motor vehicle accident, we got in a 16-year-old teenager. He is vomiting blood. His blood pressure is 80/70. His heart rate is 130 beats per minute.
All right, let me go assess him real fast.
Okay.
All right, young man, let's take a look here and see what's going on. Are you? Oh dear. Yes, well,
Oh,
let me take a listen to you.
I'm so sick, Doc. I've been throwing up. They had to change my clothes. I messed my clothes up. I'm in such pain.
All right.
Oh. Ow. Oh. That hurts. Oh, wow. Oh. That hurts, Doc.
All right. What we're going to do is order you an antiemetic. That should help things out. All right, young man?
Oh, okay.
We'll get you some pain meds as well.
Okay.
All right. All right. All right, nurse. What we're going to want to do for the young man is type and match for his blood. He's going to need some. Throwing bucketfuls of it. Find source for the bleed with a CT scan. So I'll give you the order for that shortly. All right, and then I'll reassess later on.
Okay.
Very good.
Okay, nurse Carlos, for the team that's in 2104, we got the type and match back. He just came back up from a CT scan. We found the source of the bleed. I'm going to need you to get him started with an IV, and I'm also going to need you to start blood products immediately.
Okay.
Okay?
Okay. Start an IV on a young man while I go pick up blood from the blood bank.
Yes. Stick, okay? Big stick.
Thank you, Nurse Myrie.
You're
Blood
welcome.
came in.
Oh,
I'm going to start you on some blood.
oh, I'm hurting. Am I gonna die, nurse?
What make you think that?
Because I'm in so much pain. It feels that way.
Well, I don't think so. We'll try to do our best.
Oh. Oh.
Oh, I forgot.
The 16-year-old patient, we did a type and match to determine his blood type, and we sent him to get a abdominal CT scan to find the source of his bleed. After determining he had a ruptured spleen, we removed the spleen, sent him to OR, and then after we started him on 1 liter of blood, gave him some antiemetic medication, and he became stabilized. Okay, what we have is 89-year-old female. She came in a motor vehicle accident. She is stabilized, but she's diabetic, and when we checked, her blood sugar was 550.
Oh, my word.
Yes, sir.
All right. I'll take a look.
Okay, thank you.
All right, Granny. Tell me how you are feeling.
Feeling a little bit ill.
Well, I imagine so with the blood sugar that high. No sweeties for you. All right.
Why no sweets? I have to have my sweets with my coffee.
We have to get your sugar down.
Oh, you're just like that little girl that my son married, talking to me like that.
Whatever. All right. All right, for the grandmother, I'm going to write you an order for some IV insulin, and let's do some acu-checks as well, and then we'll reevaluate later, all right? Oh, and also do a urinalysis, all right?
Okay, thank you. First call is, I spoke with the doctor. We're going to go ahead and get Randy G started on some IV insulin, and then after 30 minutes, we're going to do another acu-check, also get a urinalysis, so we can go ahead and check that.
Okay.
Okay? Thank you.
Hi, I'm Nurse Mari.
Hi, how you doing today?
Hello, Granny. Alright, the doctor ordered a urine test for you.
More tests.
I'm sorry, but I need you to go to the bathroom. I need you to urinate just a little, then wipe front to back, and then finish in the cup. And then call me when you're finished, and then I'm going to check your insulin, okay?
At least she was nice.
Okay. I'm here to check your blood sugar. Any finger?
Anyone,
Oh.
just be gentle.
Okay. It looks like it's coming down. I'll let the doctor know.
How you doing? I'm Nurse Carlos. I come to start your IV of insulin.
But she said it was lower.
Well, it went down some. It's just not quite, in a stable range.
Oh, okay.
What's your name?
Grandma?
Can you
G-
spell it for me?
Geee
Date of birth?
073151.
So how you feeling right now?
A little better. How's everybody else?
They're fine.
And my son?
Fine.
But
They're
The
all
lady.
stable.
and her?
Yes.
How's she doing?
She's fine. Okay, I'll be back to check on you.
Okay, thank you.
You're welcome.
PG came in stabilized with a blood sugar of 550, so the doctor ordered IV insulin to bring her blood sugar down, and a urinalysis to make sure she hadn't developed DKA or have glucosuria. At the administration of IV insulin and a post-Aggie check 30 minutes later, her blood sugar levels decreased dramatically to 140. Her urinalysis was negative for glucose, and she was not determined DKA.
About Mrs. G, will you please?
Okay, Dr. N, what I got in is she's 6 months pregnant. She came in from a motor vehicle accident, and she's complaining of abdominal cramps.
All right, 6 months, you say?
Yes, sir.
All right, let's go and check out this mother and child.
Okay.
Okay, we're gonna put the monitor on to make sure everything's all right with baby.
You sure?
Yes.
All right, Mrs. G, we're going to take a little look.
Okay. It's kind of early. I know it's early, right?
You know, I just saw your 16-year-old boy not doing too well.
No. What's wrong with him?
Not throwing up blood and all.
What?
He might not last a day. But
Okay.
don't worry about it.
Oh. Oh. Oh.
Oh, it's a big one. All right, I'll be back later. Had the ultrasound of the baby, so just keep the Toco monitor on for, we're going to watch out for stress-induced labor. And put her on some magnesium sulfate. How about 1 gram every 6 hours up to 4 doses? All right?
Okay.
That should do it.
Hey, Mrs. G. I'm the ultrasound tech.
Oh, okay.
Take a look at your baby, okay?
Does everything look okay?
It does. You want to hear the heartbeat?
Sure.
Everything's sounding strong. All right. I'll let the doctor.
Contact already went in. We're going to keep the Toco monitor on her, but I'm going to need you to go ahead and give her 1 gram of magnesium sulfate. It's going to be given every 6 hours, up to 4 doses max, per doctor's request.
Okay.
Okay, thank you.
Okay. I'm Nurse Corliss.
Okay.
I'm going to be giving you a shot of magnesium sulfate. The doctor ordered to stop your contractions.
Okay.
What's your name?
Miss G.
Can you spell it for me?
G.
Date of birth?
11/14/82.
Okay. Okay, you're gonna fill a short pinch.
Okay. Ah.
All right.
Okay.
I'll be back in to check on you.
Okay.
She had an ultrasound of her baby in which the baby was fine. She was having some contractions, so we administered 1 gram of magnesium sulfate to prevent her having preterm labor. We kept the Toco monitor in place and we checked on her. After 30 minutes, she said the contractions was no longer there and she and her baby was stabilized. Dr. N, what I have is a 2-year-old who came in a motor vehicle accident and she has a broken wrist.
Oh, poor baby. All right. She's stable otherwise there?
Yes, sir.
All right, well, we'll take a look at this, okay?
Okay.
How's it feeling?
Hurt.
All right, baby G. How are you? Going to take... Oh, no, over here, over here. I'm going to just take a look at your arm.
Ow, ow.
Okay. Yeah. Oh. Mm.
How is it?
Well, she may never play the piano, but other than that, you know. Now, baby G. Baby G. All right. Well, I'll see what we can do. I'll order an X-ray to look at it, and we'll go from there.
Okay.
See, it's gonna be okay.
All right, nurse. For baby G, I want to order some pain meds. I guess the 5 milliliters of acetaminophen will do the trick. Do the oral suspension. We're going to order an X-ray, of course,
Okay.
and
the doctor. I'm going to have you go in and put an ice pack on the baby arm, weigh the patient, and give her 160 milligram per kilogram of weight of acetaminophen.
Okay.
Okay?
Bring you some medicine.
Hi, I'm Nurse Mari. I'm going to put some ice on your arm to make it feel better, okay?
No. It's okay.
It's okay.
It's gonna feel better. It's gonna feel better.
See, it feels better. Mom, what's baby's name, date of birth?
It's baby Geee, G-E-E-E, 2/5/2012.
All right. Look how cute. Open your mouth.
Say
All right. No, don't do that. All right. Let me know if y'all need anything, okay?
Okay.
She came in with a broken wrist. The doctor ordered an x-ray to see what bone was broken in her wrist. After the x-ray determined it was the radial bone, we put ice on it for the swelling and administered 5 milliliters of acetaminophen for pain. And what I have is a female came in with broken glass pieces on her arm from a motor vehicle accident. She is stable, no major vessels, organ damage was noted.
Alright, well, it looks like we can just go in and take care of her now. Do you have some lidocaine with you?
Yes, I do.
Alright, perfect.
Okay.
Oh!
Hello, how you doing today?
It hurts.
Okay, we coming to help you with that.
You look exactly like your grandmother. I say.
Can I get you to state your name and date of birth for me?
GX, and my date of birth is 12/13/89.
Okay, thank you for that. I'll write that. I'll have this for you.
Are you gonna get it all out?
Check.
Oh, it hurts. It hurts.
It's gonna be okay.
It hurts.
Okay, I'm gonna be right here with you while you do it.
Now, don't be a crybaby. It'll be over soon.
It hurts.
Go ahead, I'll put some gloves on. So I can just-
Going to give you some numbing medicine, alright? Big stick! Alright, that should do.
Thank you.
Okay. And I'm gonna come back in and give you the pain medication she ordered for you, okay?
Okay.
Everything's going to be alright.
X came in with broken glass pieces in her arm. After giving report to the doctor, he came in, gave her a shot of lidocaine, and stitched her up. We cleaned her up, and we given her pain medication, codeine, PRN.
You got all of it?
It's videoing.
Oh.
Okay.
Thank you for watching our video. This is class of 2014, green class.
Green class.
Oh,
2014.
A family has been in a motor vehicle
Wait, I
accident.
Go.
Really? You think?
Get it all out. Get it all out.
Oh, wait, I didn't know where to start.
Get a blood for A1C. Start.
Her oxygen, and after. Who said no?
It's a man.
Oh.
Wait, I went too far.
Talk louder.
Yeah.
All right, now what I'm saying, Well, we full.
We full.
Speak up. Minister.
Yeah, you gotta talk loud.
That's all right. Keep going. Start over.
Start over. This time. Okay, Dr. Carlos.
Nope. No. Hurry up, nurse.
I'm glad you laughed, because that was totally wrong. I was supposed to get her to come.
What is it called? I
Chest
can't
tube.
do it. After we assessed his chest tube, he was stable.
Recording. They got a red thing in it. What that red thing is?
We're recording.
Are you recording? Oh, I'm sorry.
Can somebody say action?
Action.
Okay,
A
Dr.
little stick, okay?
Oh.
Feeling okay?
No, I'm in pain. Need something for pain. Please.
Okay. I'll go ask the doctor.
Am I gonna die? I think I'm gonna die.
Okay. That again.
You're fine.
Hello.
Date of birth?
I'm 6.
I'm sorry.
All right,
All right, do it again.
I'm 60. Yeah.
Yeah.
I don't know.
96.
Okay.